Hello, this is Dr. Bouvier with Doctor and You, and you came to this video to learn a little bit more about transitional care management and how it relates to your home health care agency. Now, the people who are looking at this video are the nurses, the OTPT speech people, and at the end of this video, I'm going to give you a challenge, and I want some feedback. So if you receive this by email, send me back an email to robert@robertbouvier.com. That's robert@robertbouvier.com, and give me your comments about the components of what we're going to be talking about. So basically, this video is about transitional care and what is the process of transitional care and what are the holes that we're seeing in your organization that need to be filled, and what is your responsibility to help make sure that gets done. So the process is pretty simple. You know, we receive a referral either from the primary care doctor or the hospitalist. We receive it in the intake. We either accept it or not accept the patient. If we accept the patient, we wait for the discharge. We send a nurse out, OTPT speech, medical social worker, LPN, whatever needs to be done, we take care of it. And we go through that process, and we expect the 485 to be signed, the face-to-face to be signed, the order to be signed, and sometimes that doesn't happen, so that's where transitional care management comes in. Sometimes there's a medication problem, sometimes you can't get a hold of the primary care doctor, and we want our nurses, OTPT people to feel very comfortable and that you've got backup. You're not out there alone taking care of this patient. I'm there responsible with you. But the components of a healthy home health care referral and a home health care process, I've come up with 15 different components, and I want some feedback from you to see what you think are the 5 most important components of a healthy home health care referral. So, and home health care process. So, you know, we've got, you know, about half of these things, maybe more than half, or more process or things we do just to get paid, but nevertheless, they're part of the healthy home health care referral, because number one, we got to get paid as well as taking care of good quality patient care. But we can't sacrifice quality patient care just to get the logistic problems of getting paid. We can't overlook either one of those to make it a healthy home health care referral. So we have to have a referral signed, an HOP or a discharge summary, the OASIS, the 485, the face-to-face. We have to have, you know, a good a skilled nurse or PT to open the case. We need to have good backup with RN, PT, OT speech, the RTs, sometimes respiratory therapists, LPNs, social work, home health care aide, et cetera, in there giving care and taking care of things. We have to have good transportation with the patient, or many times their care will fall apart. We need a good caregiver, meaning that there has to be something in the home in order to create a good logistic, good safety for the patient. Sometimes that doesn't happen, but there's different levels of tolerability that we can handle if there's not good transportation or a good caregiver. Another component of a healthy home health care referral and a home health care patient is a good primary care pharmacist. If this is the first time you've heard about this type of concept, a good primary care pharmacist is really the only person that is really out there that can tie in all the specialists, what's going on in the home, what's going on at the hospital from a pharmacy standpoint. It's probably the only person who actually receives all the prescriptions from those various people that really know what is going on with the patient, or at least has the best knowledge. So I encourage nurses and people to reach out to that primary care pharmacist to make sure that our medication list is correct. Statistically, at discharge, and for the first 3 days of discharge, there's a 90 to 95% major medication error rate. Let me say that again. For the first 3 days of any discharge with all patients from every hospital in the area, that includes all of Michigan, there's a 90 to 95% major medication error rate for the first 3 days of discharge. So to combat that, the concept of the primary care pharmacist is very, very important. So to carry on here, you know, we've got safety, logistics, level of tolerability, specialists, other people, you know, and especially the primary care doctors, part of those components of a good home health care experience or process. When those things fall apart, any of those pieces fall apart, you're not alone as the social worker, or you're not alone as the nurse, OT, or PT. I'm there to back you up. If you need an order signed, if you need a patient taken care of, a urinalysis ordered, a medication change, and you can't get a hold of the primary care, then I'm your backup for all those things that seem to fall through the cracks in home health care. Just to let you know that. And my cell number is 810-610-7972, 810-610-7972. If you need me to lend a hand, then I'm there to help you. But we do have to have a primary care doctor there of record, so things are being taken care of when the certification period is done. So if there's not a primary care doctor of record, and you know about it, either as a OT-PT speech, the internal workings here at the office, then we have to either send our own nurse practitioner out or a visiting doctor, a visiting provider of some sort to become the primary care person. As a transitional care management specialist, I'm not the primary care, and I don't function as the primary care. So we need to have a good primary care process out there. So here's your to-do list. I want you to think about what you think are the 5 most important components of a healthy home health care referral and a successful home health care referral. A success would be we've been able to help people stay at home, out of the hospital, out of the emergency department, and they're actually improving, their quality of care measures are improving. From the administrative side, it's that we've got all the I's dotted and T's crossed for the billing process, so we actually get paid for that quality of care. So keep all that in mind. I want to, for those of you listening to this, I want an email back from you listing those five most important things that you feel are make for a good home health care referral. Again, this is Dr. Robert Bouvier with Dr. New here sitting at home base for your home health care agency. Thank you very much.